If an MRI result shows that there's a large tumour, be it benign or malignant, then invariably surgery is required to treat those tumours. Benign tumours essentially cause destruction from its growth, cause compression of the brain. So surgery will then be required to remove the benign tumour and to also prevent further damage of the surrounding brain structure. So for example, if the tumour is sitting on the front part of the brain, you've got a benign tumour, the front part of the brain is being compressed over time. And if nothing is done about it, tumour keeps growing and there will be more brain compression and brain damage. So hence surgery will be needed to remove the tumour to prevent further brain damage. And once the tumour is removed, you can identify based on histological sampling the tumour type or the subtypes and see whether the tumour needs to be treated further with radiotherapy or chemotherapy, or surgery is cure enough for such cases. If you have a malignant tumour or a cancerous tumour which is less than 2 centimeters, in my opinion, I think the best thing to do would be to obtain a biopsy. This biopsy can be done through a minimally invasive approach to identify the cell types that are involved. And subsequently, these small malignant tumours can be safely and effectively treated with radiotherapy, provided that they remain small. When you have a malignant tumour which is large, more than 3 centimeters, then surgery would be needed to remove the tumour because tumour is causing destruction to the surrounding brain tissue. If left alone, the destruction process will not stop, will only progress, and you have damage to more and more brain tissue, and that will result in very bad outcome for the patient. Patient will probably be rendered paralyzed or worse if the tumour is not treated. Surgery will then be done to remove the tumour. At least 90 to 95% of the tumour is removed by surgery. And then subsequently, once we've identified the cell types, we can use radiotherapy or chemotherapy to eliminate the remainder 3 to 5% of tumour that may have been left behind to make sure that the best treatment to eradicate the tumour is then given. Tumour response to treatment essentially depends on the type of tumour that we're dealing with. Certain tumours respond rather quickly, certain tumours are not very responsive. Essentially, we're looking at a time frame of up to 6 weeks of radiotherapy and chemotherapy. Typically for tumours that arise from the brain, primary brain cancers such as glioblastoma multiforme, these tumours are treated with a regime lasting up to 6 weeks. And then depending on the response of that tumour to the regime of treatment given, treatment can then be continued into a maintenance phase, or perhaps maybe a different type of chemotherapy is used to further control the tumour if necessary. Some treatments may last longer than that, up to 3 months. And that really depends on the tumour response to the chemotherapy or radiotherapy that is given to the patient.